Broadcasting from Berlin, this is a DW News special edition on India's unfolding coronavirus crisis. More than 1.5 million cases in just a week and thousands of deaths every day. India is overwhelmed. Crematoriums are working overtime. Hospitals can't take in more patients, and some medical supplies are running low. How did it come to this? And will things get worse before they get better? I'm Biresh Banerjee. Welcome to this DW News special on the tsunami that India's second wave of COVID cases has turned out to be. But it's a tsunami that hits the country every day. In case numbers, more than 380,000 in the past 24 hours, and in the numbers of dead, more than 3,500. DW's India Bureau Chief Amrita Chima is reporting through this growing crisis and joins me now from Delhi. Amrita, another day and another deadly record for infections.
That's right, Biresh. Bad numbers coming out of India. Now, another record, as you said, the number of new infections today, a record of the number of deaths in Delhi, and a high positivity rate of 21% across the country. Hospitals are overwhelmed, as you mentioned, and in fact, the Chief of the Army Staff has met the Prime Minister and he's offered military hospitals even for non-military personnel. So the reports I'm hearing are that also the military hospitals are pretty full to capacity. In another development, some 350 scientists have appealed to the government to provide them more scientific data. For example, the sequencing of these variants and mutants, tracking clinical results from vaccines, how people are testing. They say they need this, what they call granular data, to get a better sense of what this crisis is like. Another grim reminder of what we are going through right now is not just the hospital beds and oxygen that we are running out in Delhi, but also space in cremation grounds and burial grounds. There's simply not enough space for the number of bodies which are being brought in.
And Amrita, in the midst of all of this, India is also set to begin vaccinations for anyone above the age of 18 from Saturday. How prepared is the government?
Not very well, as it turns out, Biresh. It was much touted that on the 1st of May, everyone over 18 could be vaccinated. As it turns out, there's simply not enough vaccine supplies. Under India's federal structure, the government of India allocates a certain number of vaccines to each state, and the rest the states themselves must procure. And some of the states find they don't have enough vaccines. They're thinking of now either delaying or postponing the start of this expansion of the vaccines. And some cities like Mumbai have stopped vaccination altogether for 3 days because they have no supplies. So it's quite a setback for the government, because vaccination was a key pillar in their strategy to bring down and break down the chain of transmission and bring down the numbers.
And other countries are also helping in. There is a lot of aid that is poured in. Is this enough, Amrita, or does the government need more aid?
Well, the government and Prime Minister Modi have always been very proud of their self-reliance. But this time, in their hour of need, they are very happy to welcome aid coming from some 40 countries. Some of the aid has already started coming in. Some is still on the way. But the critical thing is, how fast can they use this aid and take it to people who need it most? That is still the critical question, because time is of the essence. Is this aid enough? With a crisis of this scale and a country this large, I think always more aid would be welcome.
Amrita Chima, thank you very much for that. DW News Bureau Chief in Delhi. Please stay safe. The deadly chaos of the second wave of coronavirus infections is in stark contrast to the first. Last year, India dealt with that by imposing what was called the world's strictest lockdown. India's streets fell empty and coronavirus case counts dropped eventually, seemingly contrary to warnings about the danger India faced.
Even before the coronavirus spread around the world, epidemiologists warned that India could see the worst of it. Some of the most crowded cities on Earth, coupled with an ailing healthcare system, foreshadowed disaster. But the first wave of the pandemic seemed to have spared India. At the end of March 2020, Prime Minister Narendra Modi ordered a total lockdown of the entire population for 3 weeks, the most severe step taken anywhere in the world at that point. It appeared to be a success. By the beginning of summer, the country of 1.3 billion people was still recording a small number of daily cases. When monsoon season hit, cases rose steadily, peaking at over 90,000 per day. But in October, with the virus in decline, government scientists speculated that India had reached herd immunity. Modi spoke at the World Economic Forum at the end of January, declaring the virus defeated.
The country where 18% of the world's population lives has saved the world, entire humanity, from a major tragedy by effectively controlling corona.
When India began vaccinating, it took pride in exporting vaccines to other countries in need. Then came spring, and with it the spread of two new coronavirus variants, British and Indian. Cases began rising. The government imposed some restrictions, but millions gathered to celebrate the holy festival of colors and Kumbh Mela at the Ganges River. India's second wave was swift and unstoppable. The case count in April has doubled every 10 days, an exponential curve. Even the most optimistic models predict India could see another month of this before the second wave peaks.
DW correspondent Nimisha Jaiswal joins me now from Delhi. Nimisha, you've been in the thick of this deepening crisis, speaking to patients, doctors. What are they saying? Will things get worse before they get better?
Well, Paresh, for patients, it's simply a crush to find treatment. We've seen people being carried to the gates of hospitals completely out of breath, being told that there is no room, they cannot be helped. For relatives of these patients, they're scouring social media, Twitter and Instagram, looking for beds, medicines, and oxygen as well. For those relatives who manage to get their loved ones admitted into a hospital, that is considered a victory already. Doctors are under immense stress. They insist that they will continue striving on, but with cases pouring in every day in thousands, this in itself is a massive challenge. They do point out to me that India had let down its guard, and that could be why this wave is as massive as it is. But without resources coming to them, they are scrambling as well to not only treat these patients, but to even give them necessary medicines and oxygen.
Speaking of India letting down its guard, back in January, Prime Minister Narendra Modi had said that India had shown the world how to effectively battle the pandemic. What do Indians now say to that claim?
Well, Paresh, it's pretty safe to say that there has been criticism almost across the spectrum. Not just journalists and the opposition, but many citizens as well have come out to ask what exactly happened. How did we make such massive mistakes? For example, there were warnings that supplies of oxygen should be shored up, but clearly they were not. There is a crisis ongoing in every major city, and we're hearing that rural areas are being hit very hard as well. But I think most concerning for many people is this government's firm denial of any admittance of a mistake that they may have made in the handling of this crisis. As recently as March, the health minister of India had said that India has entered the end game of the pandemic. And earlier today, he pointed out that India has the lowest fatality rate. There are concerns that if you do not acknowledge a problem, you cannot solve it.
Do Indians then trust their government?
Well, Paresh, Indians will follow curfew, they will mask up, they will respond to restrictions, they will respond to appeals to get vaccinated, but the trust element may well be diminishing. So far in political discourse in this country, most people are firmly entrenched into either camp that supports the government or those who criticize and oppose it. Now,
Right.
more and more, we are seeing supporters of the government also question what exactly happened here, how did we get here?
A tragedy that's affecting virtually every Indian. Nimisha Jaiswal in Delhi, thank you very much and stay safe. You're watching a special edition of DW News on India's coronavirus crisis. Still to come in the program. Researchers around the world are trying to find out all they can about the B161 coronavirus variant circulating in India. But just how deadly is it, and what can be done to prevent its spread? The coronavirus pandemic is having a massive impact on India's public health system. But what about the mental health impact on people who are not sick with the virus? We speak with young Indians trying to cope. Now, dozens of countries around the world, including the UK, the US and Russia, are sending aid to India. Planes carrying oxygen-generating plants, ventilators, antiviral drugs and protective equipment for India's health workers have been landing in India for days. The European Union has activated its civil protection mechanism and is also sending shipments of medicine and equipment to help fight the spread of coronavirus in India. Let's bring in Yannick Lenarčič, the European Commissioner for Crisis Management. He joins me now from Brussels. Mr. Lenarčič, welcome. What kind of support is the EU providing to India?
India requested assistance in the following forum. They asked for oxygen devices like concentrators, generators and cylinders, and antiviral medicines as well as ventilators. Upon receiving such a request, we have immediately activated our civil protection mechanism. We reached out to all member states of the European Union and we have received extremely generous and quick response. By now, more than half of EU member states have already offered assistance on these particular items that India requested.
What about vaccines? Scientists are saying that India also requires vaccines. Is the EU planning to send vaccines to India?
India has so far not requested vaccines from the European Union. Our civil protection mechanism works in the manner that we respond to specific requests, and the specific request from India so far has not yet included vaccines.
Is there a plan within the European Union that if India were to request for vaccines, vaccines would be readily available from the EU?
I would not exclude that. The fact is that almost half of vaccines produced in European Union are being exported from day one. So European Union has already displayed solidarity with the rest of the world, and I would not exclude its readiness in the future to also share its vaccines.
Can you put a number on this readiness to share vaccines? How many millions of doses can the EU spare at a moment's notice?
I don't have the current number, but I do know that about 150 million doses have been administered so far within European Union, and almost the same amount of vaccines have been exported from the European Union, including to the so-called COVAX facility, which is intended to provide the vaccines to 92 low and middle-income countries all over the world.
There are also calls growing for vaccine technology know-how to be shared with other countries that can produce these vaccines. Is the EU open to sharing that technology?
The European Union supports collaboration and voluntary licensing in order to ramp up the production of the vaccines. Initially, the big issue facing Europe as well as the world was limited production capacity. This has now been improved also through the measures like collaboration and licensing.
Are you worried that the kind of pandemic that we are seeing deepening every day in India will potentially harm India's the supply of vaccines that India can deliver to the rest of the world, including the EU? Is that a concern in the EU right now?
We are concerned because of the situation in India very much. First of all, because of the situation affecting Indians themselves. But second, also because India is one of the biggest, if not the biggest, producer of vaccines worldwide. And until the current crisis, India has exported tens and tens of millions of vaccines produced in India to other parts of the world. These exports have now stopped, and this may have the negative impact on the availability of vaccines in large parts of the world. So we are concerned, and we will try to find a way to make up for that.
Yannick Lenarčič, the European Commissioner for Crisis Management, thank you so much for joining us from Brussels. A new double mutation of the coronavirus in India has been partly blamed for the rapid increase in cases. It's said to be more infectious and deadly than earlier variants. Here is what is known so far about it.
The West Indian state of Maharashtra is where the B1617 variant of the coronavirus was first recorded in December 2020. The strain has 2 mutations on its spike protein. That's the bit of the virus that gets it into our body's cells. Both genetic mutations have cropped up before around the world in other strains of the coronavirus. And when they did, they were linked to the virus passing between people more easily. They were also linked to the virus being better able to get past the body's defences.
We've seen a systematic increase in cases across India, more or less taking off at the same time, suggesting that what might be happening is that something that is more transmissible between people is very rapidly moving through the population of people who are yet to contract the infection and therefore spreading faster.
But how quickly does this new type spread? To get a handle on that, researchers need to be able to see when people have it and when they die from it, which means sequencing the virus's genes. That research has been extremely limited so far in India. Out of millions of cases in this new wave, only around 1,000 sequences have been published. Meanwhile, scientists across the world are working to find out how deadly B1617 is. As the number of people dying continues to rise, their answers can't come quickly enough.
Joining me now for more is Dr. Lancelot Pinto, a pulmonologist and epidemiologist at the renowned Hinduja Hospital in Mumbai. Dr. Pinto, welcome. Do scientists in India have enough data to be able to understand the B161 double mutant variant?
No, I don't think we have enough data, and I think far more sequencing needs to be done than what is currently done to really understand the transmission dynamics, to understand whether it's been associated with reinfections, whether questions around immune escape, questions around virulence, and questions around transmissibility. I think we have very limited information at the moment.
But Dr. Pinto, why is that? I think the first reports of this virus became available in October last year, then again in December, and then in March earlier this year, the government, in fact, had a press release. Why do we not have scientific data as yet?
I think to a certain extent that's limited by the expense associated with whole genome sequencing. My understanding is that it's not very inexpensive to do. But yes, a part of that is because I think maybe the gravity of knowing these mutations is not fully comprehended and understood, because it may not necessarily convert to treatment outcomes or implications immediately, but one has to be farsighted when it comes to these kinds of things.
You are a doctor who's working with COVID-19 patients on a daily basis. What is this variant doing to the body that's making it so deadly?
So I'm not really sure whether it's more deadly than the first time around, but we do know for a fact that it appears to be a lot more transmissible than the first time around. So the first time around, when the average rate of infection among close contacts was about 10 to 15%, which meant that in a family of five, for every 5 individuals who were exposed to a patient, 1 would get infected. This time around, we are clearly seeing entire families, entire workspaces, people attending a marriage ceremony, for example, a significant proportion of them turning positive, which suggests that it's highly transmissible. And I think when that denominator becomes as huge as it is right now, even if a small proportion of individuals need hospitalization, need intensive care, that converts to a whopping number. And I think that's what we're really seeing. I don't think we're absolutely convinced that it's a more lethal variant of the virus yet.
Given how transmissible this is, are there any actions that people can take to avoid getting infected?
I think viruses are known to mutate. Coronaviruses are going to keep mutating with time. And I think the most efficient way to prevent that is mass and rapid vaccination. So I think if you vaccinate enough individuals, you prevent this constant cycles of transmission. And transmission is eventually associated with mutants. This is called selection pressure mutants that develop. If people are vaccinated enough and that transmission cycle is broken, I think we would succeed in preventing the emergence of new mutants and variants.
You want to see mass and rapid vaccinations. How hopeful are you that that will happen given the vaccine stock in the country?
not very hopeful at the moment, but I think things are changing. I think there's aid which is coming from the US. The US is sending us a whole stock of vaccines, which we're very optimistic and hopeful about. I think there were certain supply chain hurdles which have been cleared at the moment, and hopefully that will allow us to ramp up production. I think the government has also provided some sort of an incentive in terms of funds to the vaccine manufacturers to scale up. If they do it fast enough, I think there is hope around the corner. I think the other vaccines have also been put on a fast track for approval. So the more the number of vaccines that enter the country, I think greater the probability of us being able to scale up vaccination.
What is your honest prognosis, doctor? Do you think case numbers will continue to rise in India before they stabilize? Are we still awaiting the peak of infections?
So I know for a fact that the state of Maharashtra, the state in which I practice, is kind of plateauing out over the past 4 or 5 days. It does appear that the number of new infections appear to be plateauing out. Of course, we know that mortality, deaths tend to lag by about 2 or 3 weeks. So, unfortunately, I think the need for critical care beds, the need for ventilators has still not peaked, unfortunately, in the city of Mumbai. If you look at the trends from last year, the state of Maharashtra and the city of Mumbai were the worst affected initially, and then the rest of the country followed suit. But so did the recovery patterns. So based on the recovery patterns that I'm seeing in Mumbai and in the state of Maharashtra, there is reason to be optimistic that within the next 2 or 3 weeks, hopefully the rest of the country will follow as well.
Dr. Pinto, could a lot of the horror that we are seeing currently have been prevented with better preparation?
I think mistakes were made all around. I think in hindsight, a lot of people probably regret a lot of things that they did in terms of lowering their guard, in terms of gatherings that occurred, which possibly should not have happened, given the fact that we know over the past 1 year that gatherings of people in closed spaces, in crowded spaces, and close contact of a whole bunch of individuals is the most efficient way of spread. So in hindsight, I do think that we could have done a better job in preventing spread at a mass level, at an individual level as well. I think we got very optimistic and complacent after the numbers went to an all-time low in the months of December and January, after we survived through Diwali, after we survived through New Year's without seeing spikes. I think all of us collectively let our guard down, and I think we're paying the price for that. So yes, this could have been prevented to a certain extent, but I mean,
Right.
That's what we're realizing in hindsight now, unfortunately.
Dr. Pinto, I can't imagine the stress you and your colleagues are having to work under on a daily basis. How are you and your colleagues coping?
I think all of us are stretched thin over the past year. I think we don't see light at the end of the tunnel, which is a very difficult circumstance to work under. When every time you see a glimmer of hope, unfortunately, there is another wave that pulls you down. I think all of us are close to our to the end of our patience, to the end of our resilience. I think all of us are a lot more irritable and a lot less patient than we used to be last year. But that's just the way it is, I think.
Dr. Lancelot Pinto, pulmonologist and epidemiologist at Hinduja Hospital in Mumbai. Thank you so much for joining us, and thank you for the work that you do.
Thank you for having me.
As Dr. Pinto alluded to there, India's coronavirus health emergency masks another medical crisis that's been bubbling away, hidden from view from the last year itself. The impact on the mental health of its people, repeated lockdowns, death, illness is taking a toll across all age groups in all settings, urban and rural. But with a sizable population of young people, the impact is especially hard on them.
Breakdowns, fear, anxiety. These are the words 29-year-old Kanika uses when asked about how she's coping with the second wave of COVID-19. Both her parents are COVID positive, and her father has been in the hospital for days.
Personally, for me, it's been an emotional mayhem. In this second wave, my dad became a victim, and a very serious one. And it just made me realize how crazy things are at the moment.
Kanika runs an online mental health platform, MindPeers, which connects people to therapists. and the statistics are enough to tell her that she is not alone. Apart from anxiety, depression, and grief that many are already experiencing, she says a lot of young people may end up suffering with PTSD or post-traumatic stress disorder.
Last year, there were about 50 to 60 therapies that were coming in one day. And right now, from the last 3 to 4 weeks at least, that has touched 250 a day.
The second wave has been catastrophic. Images of people gasping for breath and collapsing in front of hospitals where no beds or oxygen are available have impacted the mental well-being of many. Some experts are convinced this wave has triggered a mental health epidemic of its own. Therapist Shweta Srinivasan says many young people who come to her feel hopeless and anxious over an uncertain future.
We're all also collectively going through a traumatic space right now with the pandemic. Our bodies are responding with anxiety, with numbness, with overwhelm, and which means that none of us is prepared to handle an event as traumatic or as difficult as this on a global scale.
Srinivasan adds that being constantly connected with the world online and accessing new information, while helpful, is also impacting the country's youth.
By the second, we're getting updates from hospitals, cemeteries, crematoriums of these very, very triggering, very distressing images of people who are sick and dead and grieving families, and it's obviously affecting us.
I don't think it's an experience that any of us will ever recover from. Yes, we need help as we recover from this. Yes, hopefully more and more people will seek help when it comes to their mental health. Hopefully it'll increase conversations about it.
Both Arushi and Shayantan have been doing what they can to help by amplifying requests for emergency aid on social media. They say that while there is an overpowering feeling of helplessness, there is also some optimism in the way young people have been mobilizing help in these times. For Kanika, it is her work at MindPierce that has been helping her cope.
When I come back from the hospital in the evening, I'm just working because I know if I'm not going to distract myself, I'll just cry.
As she struggles to maintain a positive mindset, she is doing everything she can to bring her father back home soon.
And joining me from Bhopal in central India is Dr. Anant Bhan, a public health policy expert. Dr. Bhan, welcome. Now, you have been looking at the mental health impact of the coronavirus emergency in India. Do you think young people are particularly vulnerable?
Thanks for having me. Yes, absolutely. Young people are certainly quite vulnerable. You know, this has been an extended year, much more than a year of lockdowns, stoppage of schools, colleges, just a lack of certainty on when things will improve. They've also seen, in lots of cases, illnesses within family, losses within family, perhaps not being able to reach out to friends and meet them in the way they were able to have support systems earlier. There have been increasing cases of domestic violence, and all of that obviously has a toll. Especially now, I think with the increasing number of cases, the negativity all around, the visuals they're seeing on TV, it is adding to the mental health toll.
I'd like to talk a bit about the frontline workers, the medical professionals, doctors, nurses, medical attendants who are literally at the front line of this crisis and have been for more than a year. We were just talking to a doctor from Mumbai who was trying to explain to us what they go through on a daily basis. What is the impact on medical health professionals such as these?
Well, there is a lot of anxiety. There is some palpable fear as well. They've seen many colleagues get infected. They know that they are taking great personal risk in offering care, obviously, but given the kind of profession they are in, they obviously prioritize patient care over their personal well-being. But it does come at a cost, because every day when they go back home, they are fearful about taking back the infection to their families. Many of them live with young ones, many of them live with elderly family members. And it is quite stressful. We've seen many health providers, unfortunately, die during this pandemic, and many of them continue to get sick, and they don't really have a breathing space because there is a shortage of health professionals. So every day they have to go and do work in these kind of stressful situations where it's a matter of life and death almost every minute, and to have to take decisions around triage, around saying no to individuals when there is not a bed available, not enough oxygen available, can be incredibly traumatic.
Do people have any recourse to help or assistance?
Well, it helps obviously to talk about it. People are also, reaching out to other professionals. A lot of mental health professionals have stepped up and are trying to be available. Everyone's trying their best to be able to be there. These are incredibly tough times for everyone, but the health provider community, the larger community of frontline workers, I think everyone is trying their bit to try to help out. The fact that this is a situation which warrants this kind of a response is unique, but also unfortunate.
India has barely one psychiatrist for every 100,000 citizens. Clearly, India is under-equipped to deal with mental health. I'm wondering if you think that this has not been a priority area for the government in the past.
Well, mental health has been historically neglected globally, not just in India, but even in India, the numbers clearly show that the mental health burden is really not known very well because it's not been studied adequately. Many of my colleagues have been working for many years trying to come up with data to show how important mental health is and try to then come up with a response. As you were rightly saying, part of the issue is that specialists are in scant supply. So if you rely on models which only require psychiatrists or psychologists to be available, it's going to be very difficult to offer mental health care in a country of India's size and population. What might be more useful to look at are models where there is task sharing, where you can work with frontline health workers, train them to offer first-line mental health care, and then build referral mechanisms. There is now enough evidence that this kind of work can be very useful for mental health care provision, especially at the primary care level.
Talk to me a bit about the rural areas of India. I mean, the urban areas still at least have some sort of mental health care facilities. There are at least some psychiatrists there. What about the rural areas of the country, in the villages, in the hinterland? What is the situation there?
Yeah, so psychiatrists and psychologists can be difficult to find. You'd be lucky if you have a psychiatrist at a district level. If they are there, they're usually at the district hospital, not lower in the health system. There are some medical officers who might have been trained to offer preliminary care, but in most cases, patients with mental health conditions are either not identified, and if they are identified, they're usually referred up, where there can be a loss because not every patient who's identified will go to a district hospital or to a tertiary care medical center. The models which we have worked with, other colleagues have come up with in South Asia, involve training frontline health workers such as antenatal midwives, such as accredited social health activists, so that frontline health workers at least are able to identify those with mental health conditions, offer care to an extent possible, and then refer those who need more specialized care. This way, you don't end up having to send everyone who's identified with a mental health condition to a specialist, but you are able to provide care more closer to the community.
That is at a policy level, but just at an individual level, Dr. Bhan, what can people do to tackle their fears and anxieties?
Yeah, well, there's lots of things people can do. Certainly, one is just being cognizant of the amount of information and misinformation which is being shared, having support systems around them, having trusted people they can speak to, as well as knowing if they are having persistent symptoms of any kind which might indicate that they have a mental health issue of any, then they should go ahead and access care. There is a lot of stigma around mental health also which needs to be broken, including in our communities. Just in the same way we would access care for a physical ailment, we should feel comfortable seeking help if we have a mental health issue.
Dr. Anand Bhan, we'll leave it there for the time being, but thank you so much for joining us from Bhopal.
Thank you for having me.
India's second wave is a tragedy that has hit nearly every Indian, including this one. It's a tsunami that overwhelms the country every day. In case numbers, that's more than 380,000 just in the past 24 hours. Relatives trying to arrange oxygen for their loved ones, trying to arrange beds, trying to arrange medical supplies, most of the time failing in the process.
The fires burn day and night. But Delhi's morticians are barely able to keep up. These makeshift crematoriums, have become a symbol of India's COVID-19 catastrophe. This was a parking lot, but we got permission to set up an extra 24 crematorium sites. And now there are so many corpses, we're running out of firewood. COVID-19 has taken an enormous toll on India. Many died because there was no one to take care of them. For days, there have been lines of patients in front of hospitals. No one lets them in because there aren't enough beds or oxygen tanks. People feel abandoned.
And my father is in a very critical condition. I'm getting no help. Numbers are given there, but nobody is responding. Numbers are not reachable. Please help me, please. My father is dying. I can't afford another loss. Yesterday I lost my younger brother.
My father begged me to help him, but I couldn't. Do you know how that feels when your own father cries and all you can do is put him in an auto rickshaw without an oxygen tank? For 3 days, I've been walking from one hospital to the next. I've never seen anything like this in my life. The doctors are aware of these catastrophic circumstances, but they can't do anything about it. One hospital director told DW News the situation is out of control.
I'm used to making decisions and getting them implemented, but I feel so helpless now. I get more than 500 calls every day from people asking for beds, asking for oxygen, asking for help.
Many people are scared and want to get vaccinated, but there isn't enough vaccine to go around. Even though India is the world's largest vaccine producer, there's not enough for its own citizens.
We don't have any more vaccines. Please leave. Please cooperate with the police.
Prime Minister Narendra Modi has promised help to overburdened hospitals. But many say he is to blame. He held election rallies despite rising infection numbers. And he allowed huge religious festivals like the Kumbh Mela to go ahead. This is now seen as a super spreader event.
All of this gave a common message that it does not matter whether you keep distance between the people or you don't wear masks. So all of that complacency, I think, has backfired.
The consequences are catastrophic. India urgently needs help. An international assistance effort is underway, but for many, it's already too late.
DW correspondent Manira Chaudhary is in Delhi. Manira, you've been reporting through this crisis. In fact, we just saw your report on mental health just earlier in the program. I wonder, how have you fared through this pandemic?
Well, I'd like to say that it's hard to maintain a sense of calm and even a sense of detachment from your news stories when you are in the thick of the situation. We are all going through this. We are in the middle of this. And the kind of images that we have been seeing, people desperately struggling to survive, families breaking down in front of hospitals, crematoriums are overburdened, families are jostling and struggling to perform the last rites of their loved ones. These are bound to affect you. So yeah, obviously, I have been having my own share of anxiety issues, especially because I know I'm a journalist. I am aware, I understand what the situation is right now. I know how difficult it is. So that does make me anxious for my own health, for the health of my loved ones. And I'd like to say that a lot of people of my generation are going through these issues, and including people from the media fraternity. And you see a lot of this coming out when you open a social media platform, say Instagram. People are pouring their feelings out there. And one word which has been coming up and across a lot from a lot of people when you speak to them about their mental health, and even when someone speaks to me about my mental health right now, that word is, apart from anxiety, that word is that of helplessness. You do feel a very overpowering sense of helplessness in this situation. And even though people of my generation, youngsters, are using social media and trying to mobilize help, there is still an overpowering sense of helplessness, of not being able to do as much as we could to help, because clearly the healthcare infrastructure is not even on the brink of collapse. It is almost collapsed right now. So there is a big sense of helplessness here.
I wonder if there's also a sense of abandonment, but just paint us a picture of what it's like living in the national capital of the biggest democracy on the planet, where the federal government has advised people in Delhi to wear a mask, even at home.
Well, it is quite panicky, I would say. If you talk to anyone, your friends, your acquaintances, your colleagues, it is a sense of panic. There is a huge sense of concern right now because we can see that even if we do get infected, we do not have a lot of support. We can't really rely on the medical infrastructure, on the healthcare infrastructure right now because there isn't a lot of support left over there. So yes, when we talk about living in the capital city right now, there is a lot of panic, there is a lot of anxiety. People are concerned about stepping out right now. People are concerned about finding the right medical help at the right time, which would actually help save someone's life.
Right. Manira, thanks so much. Sorry to interrupt you. Thanks so much for joining us. You've been watching a special edition of DW News on India's coronavirus crisis. Thank you so much for watching. Bye-bye.